Yegusua ema shofo akwaba eba fonton for morning show so. Na de bia meka me se ebre ye adri. Frɛ wo maame, frɛ wo papa, frɛ wo nua. So wa ma no ne aka che ne say ye were live on Facebook, KANTANKA television. No fa ne fidie ne ento honom. Na ye ba betwetwe nkomo bia ehu hia pa. Obi bia ehia. Wo office na se wonni television a mesrew. Wo mobile phone ne kita wo no go on Facebook. KANTANKA television na share ye streaming live ewo hono na ye streaming live no na ye da boafo adane da omuso yi mu ema ye de morning show yi ebremo se fa me ho asiesie a Elvis makeover na etwimenim Elvis ewo awoshi me pacho ko on Instagram at Elvis_makeover freno wedding bibia wo ye bia frena obesiesie wo ho kama sanso na patmofas na ashamatade patmofas ewo danso man mames in say wedding gown be program bia wo ko bia wo frena obe pamatade asho kama na se eba dwumaku so oboye chidomo a se wuja KANTANKA organic food honomo a ene na wendie aduane pa garden eggs lettuce pepper ntuko dwa so bomode ana kohwehwe bi KANTANKA automobile omonso ada roma ene omo boaye ya hyen ehu hiaye ina omo nim ye kwan so ene omo ye so ahyen pepepe enti achimota behind FBN bank no ukọ honom omo showroom ewo honom sanso na kosamal eye etidie yade edru Mr. Tuasie enti hwehwe kosamal ekira kwan ne huna nkwa enso ye blood tonic mojeduro a wonom a edma wanum toso na wotumi edidi multiple club support dwumakuo bia omo hwentafo me pacho se wosika famu enti se wo ye maame no wontafo na so omo hwemu no de na bomode na kodan wo mo ye Canada so se wo ye dwumakuo bi so na wate wo mo nka na se wo sika bi de ma wo mo se omo fa hwe wo mo a wo mu ni bi a omo wontafo so a omo ate wo mahyiemu omo begye wo feso ene ye ba betwetwe nkomo ka kire wo nua ne se nkomo wo ho ye be bon nkomo pa ne ye be bon nkomo no obi bisa se ene yade be krampo na ye ba betwetwe ehun nkomo yi yade na ye betwetwe ehun nkomo no ye stroke be kan stroke no se me ma mete me kuro mboma o se me be stroke yi de ai se obi fa adwodwo sebi monimo a ebi won ma na nipa no kasa kra na ho aye din ema no na no chia eno ne sa stroke no obi nya bia die na wonye hwan ho pa na sase woko die no be ya abdia sa no ho ye obe manage ne sen me kaye se enye obi a ene wonye stroke a wokọ ne honom se menye stroke enti hweme se wutimi hu the right person a wobekọ ne honom ti na ye bebisa se eno kra ye die na opanyin na wabeka mensa Elvis Asare oni panyin kese a oda physio and CrossFit services ano opanyin memo akwaba na ne ye bepusa awesa na se bibi no opanyin no wontitwi wotina enkweyeti or kind of poto kasemuni ade a me abena me bo ho modern because madana mo chia me ba mo ho modern say me de be gugu form kra ama ye nyina ye nya so ntiase na se we de bi wona mentime amubu ne form a me se mo so se na mo de achem ye nyina ye ho adro opanyina Asare me mo akwaba you welcome. Oh, come and ask me so kasa kasa mami. Oh, ba sisi ya bibisa say. I can't speak tree. I can't speak. Okay, how are you? I'm fine. What say? Me hoye na ka wo kan na kase pa me hoye no. Enti ye bebo ye ho modern na ya abo modern ase de be ya yebetimi akeka ebia fine. Generally, when we talk about stroke, how would you, in a brief, how would you define stroke?
I'll keep it in simple terms.
Okay.
It's either a blockage, a leakage, or interruption to the brain. So the blood supply lacks to the brain. So,
but let's take it gradually, because I'll be translating.
No problem, no problem.
Or say it's at the so in the veins, or the blood circulation.
The blood circulation to the brain.
Mojana edie fusane ewo a ekoya adwene mo no bibia be si ho kwan nti eniema na o define stroke no ade anase ye kase obi fa adwojo a eniema ekoso a etimi manipa no efa adwojo ho nkomo na ye twetwe nti o se o si akwan bi akoso ewo moja na edie fusane no ekọ wadwene mo no ena ede eba.
Yes. With stroke, it's mostly we're dealing with blood circulation, and when the brain does not have enough blood circulation, that's where the brain starts to give up on the human body, and it can affect either the left or the right.
Okay. So until say moja na ndie frisani ye ama na nkwa adwene m se de adwene esi hia e betimi aka ubenkum anase unifa.
Yes.
Okay. So let's move to the causes. Can you enlighten us on the causes associated to all these factors?
Okay. With the causes, there are many factors, but one is how we eat, our diet. Second, we'll say our daily stress. Thirdly, it can be inherited. Yes. And fourthly is hypertension patients, high blood pressure, cholesterol. Those are all, I would say, these are the leading factors that can lead to stroke. And most of the time, we don't notice such things. We avoid those things. When we diagnose a patient that he have high cholesterol, they're like, oh, it's okay. But it gets to a point that stroke, there's no warning signs. There are some warning signs, but sometimes there's no warning sign. I had a patient who went to church. After church, he just collapsed. That was it. So half of his...
He or she didn't get any signal of...
Nothing, no signal. He woke up, went to church. After church service, coming home, he just dropped down. His right-hand side just went off. That was it. He wasn't able to walk. He was not able to move. And his speech just dropped.
Okay.
Yes.
So talking about all these causes, what are some of the symptoms? You said sometimes it will not give you a signal.
Yeah.
But, you know, at least you'll be able to get some kind of symptoms. So what are the major symptoms that someone will be having, you know, to indicate you have stroke?
With stroke, numbness. Sometimes some people start to notice they lose their speech. They start to slur their words. Thirdly, their facial expression can squeeze either to the left or to the right. Fourthly, when you wake up, maybe you are able to move this arm easily, but you notice that it's getting more difficult. The signal is not, you want to lift it, but you can't.
Okay.
Fifth, you notice that your arm starts to curl up.
It will be stiff.
Yes, it will be stiff, and this bicep contracts. When it contracts, you can't. The limitation to your hand is restricted. With your leg too, you start to notice that your leg starts to hang like this. Is my foot. The leg starts to hang this way. So there is no signal at all. It can happen either to the left or to the right.
Okay. So when you earlier on when you were talking, I remember you made mention of giving birth to someone so you can inherit from your mother.
You see. Okay. Yeah, it is inherited. Most of the time when patients come, we ask about the family tree. That maybe, for example, maybe your grandma had stroke. Most likely is that your kids who have children are the ones who will get stroke. So with the heritage, it is very important. But most of the time when we ask patients, they have no knowledge about the family tree who had stroke, or nobody has that knowledge.
So through that, have you been able to identify a specific thing that they've been doing that causes that?
Specifically, I would say our eating habits. That is one. Two, I know our life gets stressed up, but I would say stress is also part of it. Yes. And thirdly, we also, when we say, when we diagnose a patient that you have high blood pressure or high cholesterol, they don't take it seriously. They only take it seriously when something happens really bad. And I tell my patients that I'm not Jesus. Because you tell them that, oh, you are having high cholesterol, you are having high BP. The next thing you know, they start to notice mild stroke. I mean, when something really bad happens, that's when they expect some sort of magic. No, those are warning signs, and these are early warning signs, and some people don't take it seriously.
Okay.
Yes.
So how are you going to rate the growth? For instance, when you realize your left arm is numb, is it possible for that to transfer to the right side, and how quickly can that be?
Okay. I have some patients that were affected on the right hand side. We recovered them. They are now fully functionable, working, driving, and everything. But later, it affects the right. Usually, it doesn't happen. So this is, I would say, it's a rare thing.
A rare thing.
Because mostly it affects one part.
Okay.
But here's the case that this patient felt that I feel better, and he goes back to his old habits.
Okay.
That was the, let's say, excessive drinking, the fatty food. Now it affects the left hand side.
Yema oyegusua kai ahwefo se opanyi a ne twetwe nkomo no opoto ensem no na mebo modena se mebubu abafom ye ne hyase ne bisa ne se stroke yade ne krampo no de na ideba e na osimugye di ofrisane a ekoya adwene mo no se bibi ebesi akwan wo ho a na ya na edesa aba na mebisa ne se enti eniema pen na ebesi a ebemu hu se menya stroke e na o se ebi wo ho ma wonsa no wo hwe na emu ayedu maso a enyeye ebi wo ha wuti wonsa na onte se wuti wonsa ebi wo ma wonan kwamuso na wo pagya na emu aye wudududu bi wo ntumi enante na mebisa se enti niema pen na koso na ne ntentemu no se bia efi wonsa benkum anasa aba wonsa nifa ne kromo no no so wonya oyi obi ana onye stroke a wosa na yade na ye wonensa benkum oye wieye no de ohun ya na se abanifa na num mom de eba ne sane mu no e woni paduanum na obeka se entai ensi enti eno na yesi ye no enya ade a etai koso na se na nema pe krampo na ekoso a etimi ma wonya stroke no o se wo ye stress a mo se wa wontumi na wa wo dwendwini bebre etimi de ba ye didie mu yedidie mu so pa eye major factor etimi ma sa yade ekoso ewo yedidie mu ye lifestyle se de nnuane a yedididi no nti na yetumofo se yendi organic foods na se wudi a ema wo enya sa de no ena apomode na tene exercise it can help, right? So won exercise no so ta na mani nyina etimi ekose sa ade no. Now let's move to the dangerous aspect. Is it a death sentence when someone, immediately you're diagnosed of stroke? Quickly, are you going to die, or it takes?
It's a gradual
process.
But it's a gradual process, but it can be a leading death sentence when it's untreated. Because being untreated, it just overtakes the whole body slowly.
Okay.
And your functions, you lose your signals of to move, the ability to move. You just lose everything. It's just like a clip out of your brain. That's it, and you are not able to move. And most of the time with this stroke patients, instead of trying to move, okay, we just lie down in one position. Then we start to develop bed sores. Then for example, with stroke patients, the glutes, which is our buttocks, it slowly just overlaps. So what I'm saying with the buttocks muscle, it overlaps is because if those muscles are not strong, how are you able to stand up? Because when we stand, we generate power from there to get up. But here's the case that the stroke patient would just lie down in one position. That is it. And I want to say that there is no miracle medicine that can heal your stroke right away. But there is medication for stroke plus exercise rehabilitation. Because most people depend on medicine, but there is no miracle medicine that will heal your stroke within 1 week.
So share with us the risk factor with the hereditary side.
Okay.
can someone change his or her diet after birth? You know, for instance, if my mom or my great-grandfather has stroke and you're talking about our diet, so knowing the risk factors, can I change my diet that will exempt me, or even regardless of my diet, I will still get stroke?
You changing your diet is going to help. So I want to give an example. Maybe your grandfather had a stage 5 stroke, which is the worst. This is the worst.
Oh, so you have stage 1, stage 2, stage 3?
Yes. So let's say your grandfather had a stage 5 stroke. You trying to eat healthy or changing your diet and everything, it is most likely that the person might get stroke, but as not as serious when your grandfather had. Yes, because you changing your diet, when you inherit it, you're still carrying that percentage of let me just say DNA of stroke. It's still within that person, so it keeps building up, but it all depends, because if you change your diet, yes, you might have stroke, but it's not going to be as serious as maybe your grandfather had. Maybe you can have stroke, and let's say, I mean, the fastest I have treated for a stroke was 1 month, and it wasn't serious. The patient had loss of speech, and his facial was squeezed to the right, and usually it's a whole lot of process.
Okay. So can you take us through the stages? With the stage 1, what happened? Stage 2, stage 3, stage 4, and then to the last stage.
Okay, stage 1, they are able to move, but they lose their speech.
Okay.
And maybe their facial expression. Usually with those, we have to use acupuncture needles. Yes, to release the tension around the facial expression. Then we have something called speech therapy.
Okay.
That we revive the speech. Yes, so usually that is just a blockage to the artery. Now the stage 2 is they lose their speech. They lose their speech, their face squeezed to the left or right, and their arm don't give a signal. Basically, it's just like this. I mean, contracted. And their leg, they are able to walk, but they are limp. I mean, they are able to move, but it's a limp. That's the stage 2.
Okay.
Now with the stage 3, they lose their speech. Facial expression is either squeezed to the left or to the right. The function to the arm is basically you can't actually move it. Their leg, they can't move, so it's difficult for them to stand up. And the stage 4 is they start to lose eyesight. They actually basically lose their speech. So to identify something like a phone and a bottle water, is difficult for them to identify.
Wow.
Yes.
And then the stage 5 is the worst.
And the stage 5 is worse, where completely, I would say that's the worst case I've seen. It's similar to dementia. And it's a stroke.
You lose your memory.
You're
able to identify.
You can't able
things.
to identify a bottle, phone, any simple objects.
You can't.
You can't be. You can't.
Is it that through that you lose your sight, or you have your sight?
Yeah, I mean, you have your sight, but to even pronounce phone, it's going to be difficult, and you start to develop. It's like you're making your own language, like babies. That's what happens. I don't even know how to say it right, but they start to develop this. They can't pronounce
any word.
Yes, at all, and they start to talk
differently.
Yes.
Okay, so with the stage 3 stroke, can that affect, with the male aspect, can it affect your manhood?
Yes, it can.
You not be able to.
Yeah, you will not.
What of the stage 1?
Stage 1, you can, but I would say like for a few minutes.
Okay. Can stroke be transmitted
through
sexual
intercourse? No.
It can't.
No, I wouldn't. I don't think I've heard. No.
You've never heard that before?
No. no. No, 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 no.
Okay, so now what are some of the medications you can, recommend for a stroke patient?
Okay, with the medication, I will not be able to say it here, but it all depends on the situation,
Situation.
how serious it is.
Okay.
That is one. Two, obviously, with the stroke patients, we, as a physiotherapist, our patient's goal is to be independent, not dependent. So, if we should give you medication, it shouldn't be forever. We want you not, most patients get addicted to medication.
Okay, so age-wise, who can be affected by stroke?
Honestly, with my experience, I would say any age, because
Any age?
yes, because the youngest person I have treated for stroke was 19.
Wow.
Yes.
So when we talk about 5 years old,
No, no, no.
they can't be
I would say that would be I would say it's a very rare case.
rare cases.
But
Have you witnessed such
no,
situation or
not
such
yet.
cases before?
Not yet. The youngest I've noticed, I mean, treated was when I was working in Canada.
Okay.
He was 19,
19.
and he had a mild stroke.
Okay. So in terms of the age, what is the rate of the recovery? When someone is, recovering from the stroke, the speed.
The speed. Okay, you see, with the speed of recovery, I would say it depends on the blood type. Okay. Yes. Everybody has different healing mechanisms.
Okay.
Age is a big factor. Age is a big factor because the treatment I can do on a 30-year-old man or a 30-year-old lady versus who is 60 or 70, I can't. So the healing mechanism is very important. So here's a case that somebody who is 30, there's most likely that he will heal faster. But if it's somebody who is 60 or 70, it's going to take time. I have a patient who is almost 60. Okay, he's 60. I treated him for exactly 1 year. Now he's fully functional, walking and driving. But I usually say we can't restore somebody 100% to. We can't restore somebody to 100%. It's to be 98%. The reason why I say that when a stroke patient is diagnosed, even though you're functionable and everything, you will still limp. Yes, because that muscle tension will always be there. Because with the stroke, it actually changes your posture. There's something called
This is very serious.
yes, there's something called scoliosis. Scoliosis is basically a curvature to the spine, and it's basically from the neck to the waist. It's like an S, because once either the left or right is affected, you are always this way. You're always
You would definitely.
yes, change posture, and most of the time when we change posture, we don't notice. So when we are treating stroke, we are looking at stroke plus the posture. There's also another thing with the stroke. They can develop any kind of posture. I will talk about only two today.
Okay.
There's something called kyphotic spine.
What's that?
Basically, with the kyphotic spine, your spine, from the side view, your spine goes like a C. So they tend to have forward head posture and they slouch.
Okay.
So because of the stroke, their muscles become weak. They are always sitting. And our old people, we like to sit at one place. We don't want to move. And we tend to be like this. And imagine you are having stroke, and let's say you've had stroke for 2 years. You have developed more problems. And you have developed more problems. That means you have to correct, one, your posture, then your stroke. So with the stroke, posture, it can be like a lottery ticket. We don't know which can cause or which diagnosis of spine I can give. But most of the time it's scoliosis, because they lean on one side, and their spine becomes like an S. And when the spine is being like an S, it applies pressure to a muscle, which causes the muscle to be swollen than the other one. and you also you see with the scoliosis you can even not lose your eyesight but dizziness.
So to be blur, you see things.
Yeah, blur. You will not be even. I don't want to go very detailed, but
why does it want to go very detailed?
Because
you can even what?
You see,
for the sake of our viewers.
Okay, with our human body, there's something called 12 cranial nerves. With the 12 cranial nerves is our ability to move, our eyesight, our smell and everything, our brain function and everything. So with those 12 cranial nerves, with the scoliosis, it can apply pressure to any of them. It's like a lottery ticket. So once it applies pressure, you might have difficulties to even get up, move your arm, your eyesight. You start to have unexplainable headaches. Sometimes with the stroke, most people find it difficult to identify if it is a kidney problem or a spinal issue. Because when the spine pressures to the muscle, most will identify it as a kidney problem. Meanwhile, it's not a kidney problem. Yes, because the spine is actually pressuring inside. And most of the time, patients will think, oh, I have pain around this area. But when you start to look, it's actually the spine pressuring against something which can cause that pain. Yes.
So can other diseases lead to one, getting stroke?
With the stroke, let me see, any disease.
I wonder someone is diagnosed with diabetes,
yeah,
hypertension.
with hypertension, it's already like it's a possibility. High cholesterol, possibility. High blood pressure, possibility.
Okay. So with the treatment, do you suppress the cholesterol in your body, or you deal with just the massaging? Or you have other medications you recommend for patients?
Well, usually it's not really a massage, but for example, with the scoliosis, there's something called spinal manipulation. And spinal manipulation is basically since the spine is like an S, we are
actually try to straighten it off.
Yes, so basically it's more of a spinal manipulation. So I'll
working on the spine.
Yes, and basically we have
to get it back to the normal.
So we basically crack, shift, crack, shift, crack, shift. And I mean,
how do you do it?
No, I will demonstrate.
Oh, okay.
I will demonstrate.
Ora Asare ebobo ensem na so no wa kire ye say de medi kankan ne say ye didie mu eno emboa ni nyina ka ho na wo betimi enya stroke no na obobo so say ye wo stroke no mu no ye wo stage 1, ye wo stage 2, ye wo stage 3. Stage 1 no e bo no ma wo betimi anante all right, but nanti mo no enhyeda nye papa. Stage 2 no ebi wo no ma hwe na wonsa ko untumi ntinem na wonsa na ye nam. Stage 3 no etimi eka sebi wo ye bema wo bema mpo se be sori ama woni oba enya nhyiemu no edene untumi. Stage 4 no when so etimi na stage 3 no so when so etimi ye okusu. Stage 4 no so no ene de na wo ye akọ stage 5 no enemu mu ayede na etimi kan weto honom bi honom a wo hu ade krompo na untimi identify say ensuo ni anase phone ni empo won kasem no na afi wadane te sa abofra afi ni wosua kasa wo kasa na emba honom abi honom wa ka asem a wa wote ase but se bia eye ensuo no untimi mo ne se ensuo wo bo ne se de wo wonti ase mu no honom na ye se de sebi wadwene free wo homa wo hu wo background na untimi hu se onu ni stage 5 na de na aka wato keja to ne chese eno de ebi won ma wo da honom na ekuru ena wutimi da hotim je se ye danem ya ndane wa na ekuru mpo etu wachi ebi won so etimi ka wo spine na cord no etimi kwa nti wonu de obi si wonom se ya wo betimi esi wonom saa na wo ofa achia na ebasa wonti cord na yese s ebi won so se obi enya stroke na ebi won ma nante se wo be sori ananten edenti ye recover wo se won de obi kasa ye healy will be anase ya sa will be yare e wo stroke ho 100% on the on kasa 100% obetimi akasa 98%. Reason ne say so wo nante e de na wo ma wo beto egu wo nan so kakra o beka so you will limp on one other leg no untumi enante te se de first no na wusi pim me san se yare na akeka wo nipadua kwa na ma se de na wuti ye first no untumi enye ne sa bio enti now ye ba beka ye didie mu no ebre ne bre ben ene sese wudidi se wunya stroke no na se wunya biso so a wudidie mu say na sese wudidi fa nuane ben ene sese wudi ebebo ho ban ana sese wo bi nso so a enuane eben ena ye ubedi enti sesi a na ansa na obobo enema ne so ewia ye betwa ye ho na yaje enkra na bansa na ye betwa ye ho no ye be na mana bobobobo saa ensam no so ye ewe ye didie mu so we want to take it in two folds. When someone is diagnosed of stroke, what are some of the best foods that you recommend for the person? And if I've not been diagnosed, I don't have the stroke at all, what are the things and the foods should I eat that will prevent me from getting the stroke?
Okay, with the eating habits, usually we give a diet plan. Okay.
For the patient.
For the patient to at least, but it's, you see, with the diet plan, it's very difficult to follow because you have your favorite foods. And you are eager to take. Yes, exactly. But I would say.
So what are some of the abominable foods? You know, the foods that which is a no-go area you can't eat at all.
Well, let's say, for example, I know from our banku and grilled tilapia, you would have to
stop.
You will have to stop. So let's just say, for example, your favorite is banku and grilled. If you know that it's a regular thing, you will have to stop.
With the stroke patient.
With the stroke patient, but usually I don't usually cut it because it is their favorite. So you can take it once in a month.
Okay, but so you eat it in portions.
Portions.
Okay.
And you know, sometimes fufu, light soup with snails and.
Do you eat?
Of course.
Oh, brony. Was one teaching you so fufu and light soup with snails. So what's your can I papa? You eat them. So with a stroke patients, you advise them not to eat.
Yes, with such. I mean, if you know those are your favorites. You can eat them, but it should not be on a regular basis. On a regular basis. I usually say, okay, what is your favorite food? Maybe this. And you know, the quantity also is important. Most stroke patients will be very big, some will be very slim. So that's another.
So it depends on the food they eat.
Yes.
The quantity.
Yes.
That determines the weight and all that.
Yes.
So you advise them not to. So do you have a particular portion that you tell them, oh, for banku you have to eat?
Yes, if you take 2 balls.
2 balls, you have to take one.
Whatever amount of food you take, it should be
half of it.
Yes.
Okay.
It should be half of it.
And what are some of the things you tell them to eat?
For example, I tell them to take apple, for example. Okay. Apple, carrots for the vision.
Okay.
Yes. With the stroke patient, I usually tell them for calcium, because with the posture development, like scoliosis, that's an indication of lack of calcium. So with calcium too is very important. But I have learnt, and I've heard this so many times, that when we get to a certain age, we stop drinking milk. Here's the case that the older you get, that's where you're supposed to even take more milk. When I talk about milk, most of my patients will think of Ideal Milk. No, not Ideal Milk.
That's a brand.
That's not
So you say cow milk. No, you're not talking about cow milk.
Yeah. I mean, because you are going to get to a certain age, your bone starts to decrease. That's where you're.
So what are some of the plant milk that you recommend for them?
Yes,
like almond milk.
Almond milk, for example. You know, even those paper milk that the Ever Pure milk, for example. But you know, with the stroke patients, when you notice buying the milk, there's percentage on it.
Okay.
There's 3.5, 2.5, 1.5, 0.5. I recommend the lowest.
So that's a 0.5.
Yes, because if you go to 3.5, cholesterol is high. So the 0.5, even it's very rare to find here 0.2. So if you get 0.2, it's good.
It's best.
Yes. Calcium too is very important. Pear. Pear is also very important. But like I said, we have a lot of natural resources here which we don't take it serious. So I advise them, for example, if you have an orange, for example, it's really good. But I advise my patient with stroke to take as much fruits they can.
Okay.
Okay. Second, try to move.
Exercise.
Try to move. Even if you should limp. If you are limp, you can't move your leg. At least try to do something. Exactly. Don't wait for somebody.
Okay.
You get me? Thirdly, with the arm, usually the arm gets more affected than the leg.
Okay.
That's most cases.
Okay.
And it's a muscle contraction. Worst case scenario, sometimes we have to cut the muscle to extend.
To straighten it.
Exactly.
Okay. So before we come to cutting the muscle to straighten it, I will let Mr. Asare to hold on to that. We will go for a quick commercial break. Ebusiafo, medi eyi manum ti anape. Mo fan cheme why. Menu abema na me bisa na enuane bi a wo bedi a se wonya wo stroke ni bi a ai beboa. O se milk no o hyeche mu say you be 3.5 1 on the recommend say de ne fat and as ne cholesterol no e wo form kwati 0.5 enye say enye common say wobenya 0.2 mpontu do nya 0.5 na enumom na omo nyini panyimfo no recommend say omo ennom na say wudi carrot pear fruits mango anka nom ne ade nyina eboa wo pa na o hyenkwa na so wo obi a wo beye exercise mo na ye twa ye ho agenkato ye ba obi beda ho ama na abagi kwan omo fa so eboa se wo stroke ni bia massage o physio no ebe koso nti ye koso nyina no so ye bedi nkomo ne abomode a chechep uguso e chef onto for me ko ba bia beba sisia Soa ema shefo akwaba na ansa na ye betwa ye ho no oreni monyamfo Asare ona ne ne twetwe enkomo efa stroke ho ni abobo ne mani bia so me dinsa ma try pa nso so abubu atofo ma me ne me papa no ma mo hwe so monya entiase bi na ansa na ye beko no na me ditudwa say obekyerekere ye se bia obi aba na nipa no ewo yare ni bia kwan be so na obefa approach nipa na se sen na obisi aye ni nnwuma no afa no nti se wo hwa yenya abrantie bi a oda ha se ya owura Asare nso so ejina ne ho a oba be kyerɛkyerɛ yen se de obisi adi ne dwuma afa. So Mr. Asare,
yes,
so can you demonstrate to us, assuming the person is first stage stroke,
okay.
So how are you going to go about it? This is the first time you've met the person, you've had a discussion or whatsoever. You catch a force to say, "Ansan or run a better honest and say, Bria, you woman, and your brepa." And what the Robin alcohol or any tissue or the paper, a so patients know that honor was shining nose marks, and so now, or Asare so as an idiot. Me beside say, Nipanedi Kayabana or first stage in a stroke. Say na, will be see a shiny panafancy and not to who and no juma and will be doing. So, how are you going to go about it?
Okay, so this is a younger person.
Okay.
So let's just God forbid.
Okay.
He has stroke. Yeah, so God forbid that. He's a younger person, so most of the time with stroke patients, their neck tilts to the left or to the right, depending on where the squeeze is. So, I mean, their facial. Exactly. So just come to the edge of the table. Come. So most of the time, their neck either turns this way or the other way. So this is something called, this is a cervical adjustment or cervical manipulation. You might hear a crack. So relax your head.
Ooh.
Relax your head. Good. And up. You heard the crack, right?
Yes, I did. Me bibisa no to say nipa na aba no bi wo ho no ma omo stroke no mpempi no wo hwe na ne kon enti ade na o demonstrate sesi a no mete o se bi wo no so a isa say aka ne spine na se do di kanka eni nti no njo hwe na mpempi no na nanim no na achia enti ejina baby a nanim na chia kɔ no enti obe bomode enti so odane ne kon no ko sei no odane ba sei na oyeye no se de abrante ne kon mu esi tonye no okache me se obeye na mete se de kon mu ato ampa so oyeye no so ne kon mu eto sa pepepe enti se wa start free ne kon no wato ne kon no mu ewie enti owie no na wapagya no esi ho no. So that is the
I mean that's I'll just a tip of it.
Okay.
You turn around. Sorry. Lift up your shirt small for me. Why are you scared? So, okay, so most of the time with the stroke patient, if it is a curvature, so with their neck, either it goes like an S this way. So, for him, for example, he's an IT personnel. So you see this muscle here is swollen than this one. Yes. So most of the time we have to do adjustment again. So that's where we crack this part. So we basically, like I said, we crack, shift, crack, shift, crack, shift.
Wow.
Yes.
And Miss Bisa ni biono or Dane ye said odi kan or say nyame mpenu senga abranti or ye obi a wenya stroke said or ye no kon wie no or san cheche mu say esan say ne china dodo na ye kana brofo mu spinal cord no we chika say na isa honom no eba obi a wenya stroke almost say achia ye say no nti eba ne sa na so dan ne china wo hwe na baby apagya asene baby nti eba sa na wo to ba say crack shift obu no matene no obu no matene no obu no matene nsesi a no say obi a wonya stroke na chi no se de obesi ebu atene no e na oba be chirechere no.
Yes, most of the time we have to crack here. It affects the hip. So the hip becomes...
How's your cracking?
No, I mean, with the stroke patient, with the posture, it definitely affects it. So the hip goes mostly like this. That. So it causes one leg to be shorter
than the other.
To be
so
long.
That's what causes them to limp on.
Exactly. And the space, imagine my hip is diagonal. The space I have, you always limp. And you can always identify that the shoes you wear. Because you will notice that either the left or the right
is longer than the other.
Yes, the sole of your shoe, you always notice that it's rubbing off faster. Than the other one.
Okay.
Most of the time, you can also identify inside your shoe how much pressure you've
been putting on.
Exactly. Most of the time, when we put the insole in our shoe, we buy new shoes, right? You wear it for 1 week, 2 weeks. You notice that you start to have pressure. Let's say it's Adidas. You notice that the Adidas starts to wear off that print. Then you keep wearing it. You start to notice that these two shoes, one, most of the time the Adidas label will be there. The other one is not there.
It's not there.
Because the pressure keeps rubbing it off all the time. So with the hip adjustment, for example, come to this, go to the side. No, this way. Okay, good. So this is a younger person. Please, I can't do this with the older person.
Okay.
I'm just showing. This is a younger person.
So like 19 years.
19 years, yes.
That's how you go about it.
Yeah, I'll go about it. Yes. Because
Yegusua Kyei ma me ne papa nom ne nua mema ne ma ne se o se obi a wanya stroke na se age enfie mu de o yesese no ontumi nya emma obi owo 50 years and 70 years enti we ye mrantie na omanya stroke no efi 19 years kosi be 35 years
yes.
Honom na obetimi ayesei no enti so obi honom a wo hwe empempi no hwe na ne nan baako awa achen baako because e ka wo spinal cord na e ka wo sisi na ma ujonko no achia nti ebasa de ebemu hu pan ye wo mpabo a wo hye bi wo no ma emu no hwe na ya twero bibi wom wo nai ba ko no mu de no ewo ho de ada no esan se pressure wo ba ko so ba ko gisi mu nti no wo hwe na emu no ewe anase even mpabo na se krampo no na ase na ewe nti eba wo hip no na se wo ba na omo ebe kra na kwan a omo befa so a omo beye no ni.
So with the stroke patients, most of them, the hip, usually when they are younger, if they are diagnosed in a younger age. Sometimes we have to do adjustment to the hip.
The hip.
So we put them to this position, and the tailbone, we crack it.
Okay.
So since it's a curvature like this, we try to adjust, and it's a series of adjustments.
Adjustment.
Yes.
And you don't use just one day to
Exactly.
do that.
It's not one day, because with the stroke, with such scoliosis, since the spine is like an S, so assuming it's like this, you're giving pressure to your lungs, your heart, and these are, assuming these are my rib cage. As I am breathing, it's supposed to go in and out, but here's a case, scoliosis, it goes this way. So it's a pressure, definitely pressure to your lungs. Your breathing pattern will change. Your heart will also start beating faster. Yes. So I'll demonstrate. So for example, the hip adjustment. Make sure this is strong. Breathe in and out.
Oh.
You heard the crack? Good.
Hey. Enya adwuma ketewa o. Enti se de o si kire na se bia wonya chema ewo wo hip no. Won wo jonku honom no. Enti se de o si ye no ye na brante no honom no emu ato. Esan se o kire se me fa na se bia wo mfe. Se ba stroke yade na se bia wo home a emu bie na ekakọ emu bie na ekakọ. Esan se stroke ni ti wo hwe na achia. Nti se chia saa na wo home na wo ye ayina etimi ka wakoma ena basa so ma home no eye ntentententem so nti wo ba na ese de achia no omotimi bom modene ye etene no se de be ya wo mu entene biem na mom ese wo hwe hu se enye da krope ena omode eye saa di saa adwuma no eye nkakra so mo hyase efiri bebe se ye hyase no o free ye kona ye toto mu afi de wie cha odi be pie n'echi o tenetene e banti mo ma ye nhye ni nyina so enso. So what are some of the things you do again so after doing all these corrections?
There are a whole lot of things I do, but
so apart from this, let me come in. Do you do proper, as in massaging? You know where to tell with the tissues and all that?
Yes, we do that. We do that also, but most of the time, that's why we have to. With the stroke patient, definitely they will have a swollen muscle, so we'll have to break it down.
So always their muscles are swollen?
Yes, that's
with the stroke patients?
Exactly.
Okay.
Even with because of the posture development they have, they will always have that swelling of muscles.
Is it painful?
Yes, sometimes it is painful. Okay. I won't lie. So
okay. So they go through all these pains, and then during the physio, do they, go through pains?
Usually the first day, there is pain. You see, it's very funny is because when you go for treatment, the first day you have pain. The second day, the pain disappears automatically. Third day, pain is not there. The fourth day, that's when you start different types of pain. So assuming a stroke patient was like, I always have waist pain. I'm always having back pain. Obviously, the following day, they will have general body pain. Second day, everything goes away. Third day, they don't feel it. The fourth day, that's when they start to feel, okay, I'm having pain more around this side. I'm having pain more around this side. So now it becomes a specific
area.
Exactly.
So where you give the treatment to.
Exactly.
So when they come, you don't give a general massage.
No.
You take it from one place to the other.
Yeah. Assuming first we can start with reducing the muscle. I wouldn't say it's really a massage, but we actually have to dig in. So you lie down, for example. You lie down. Lie down. So, for example, this young man has swollen muscle on the right-hand side. And sometimes I have to pressure, breathe in. Okay, and out. I'm coming. Breathe in and out.
Wow.
So it's based. So some muscles tend to have knots, and they build up. They build up. With the knots, it's like tiny stones. The blood circulation, the excessive of blood circulation is very poor, so that becomes having knots. And it starts to build up. That will cause this.
So does it grow?
Yeah, it grows. It grows, it grows, it grows, and it becomes this swollen muscle.
Wow. Yenya ofrefo bi pie ya homa na tumti ese ahwefo se ubetimi afre na wasembisa wo ma owura Asare no ubetimi e dia tudwa na menua ba bi frefe in second me pacho me wakọ aba
Pacho me so pacho good morning.
Good morning dear pacho within
Pacho e friend Amida.
And okay me pacho wasembisa
Pacho ti say addiction na pa me bumusa me right hand no. And say me so idea me ti say me ti pains for me fingers.
Fingers.
Enti eni so ye friend say
signs of stroke maybe ana okay me pacho obey you one. You heard her?
Yes, please.
You were. So is it a sign of stroke?
Okay, with her telling me about...
Speak Chi.
No, I can't. I can't. I can't. I love to, but the terms I can't.
You can use it.
Yes.
Okay.
With her numbness to her fingers and sometimes not able to lift up her arm. One, either it depends on the type of job she does. Because if I should always, let me see, if I should sit and slouch all the time, where are you going to get that excessive blood flow? Yes. Secondly, is that if she's having numbness, it's poor blood circulation. Thirdly, maybe, I don't know, but I have to see it physically, but I'm just giving a maybe. It's most likely that there is a muscle contraction. So if I should diagnose if it's a stroke or not, I can't. I have to see it myself. But what I know is that it's already a sign of poor blood circulation.
Okay. Enti menua ba o see ebetimi agina adwuma poten a wo ye so o fatu bi so bi won ma wote won no bi wakunko mu se ya cha ebede na moje etimi adi afrisane ewo mu enti me so aya ahwa na so so pese ohun se de wotete dwuma de be kwa wiye de ne number ebetu dwa na wafre na wakwa hu no na won ne di nkita ho mpacho yenya ofrefo ebi ewa homa no so mpacho me wakwa aba. Hello me pacho messages and so bana banti emrene ko enimo no making kind be. Good morning Abena, I'm Richard Isel from Apam. I'm wishing Miss Irajua Safo long life, more blessings you. Or was a please with the stroke issue, can it be hereditary? Said
yes, it is. Yes.
Please, some people say too much exercise can cause stroke. How is that true? You said some people can.
Okay.
So said okay, yedi kan aboboso emowura Asare can say ye betimi ediawo. And I was saying bisa to us say obi betimi enya stroke wabra yes so exercise bebre obi betimi enya stroke.
With the exercise aspect, exercise, the whole point of exercise is to expand the blood vessels or expand vessels to increase blood flow.
Circulation.
Yes, blood circulation, exactly. Now, most people, they exercise 7 days. Nobody should be exercising 7 days.
Nobody should exercise for
I mean, most of the time they exercise throughout the 7
days.
Yes.
You don't have to do that.
No, you can't. Assuming bodybuilders, athletes, there should be a resting day.
Okay.
So assuming Monday you exercise, Tuesday you rest, Wednesday you exercise, Thursday you rest, Friday you exercise, Sunday you rest. So you exercising every day, it's most likely you're even going to get a heart attack.
Okay. Pacho so mommy. Mini Anita if wager. Anita pacho me mo akwaba.
Yes, ma'am.
Abigail akwaba. Me pacho wase mbisa.
If I told me, mommy, it's like maybe sorry, or complaining, the last year, I said, and I say, two from, and I know who I'm say, and no free.
Okay. Me pacho koso ashena obe you are not. Did you get her question?
I didn't get it.
He said the mom has been experiencing excessive pain. Yeah, in her leg
Okay.
So what are some of the causes? Is it that, I mean, she's about to get stroke, or it's a sign of stroke?
I don't know if she's able to walk, but okay, let me just, if it's an excessive pain to her leg, one, it can be that the muscle tension is so hard that to get up is going to be, it's always a pressure like this all the time. Secondly, the muscle behind her thigh can be also that when she tries to get up and that tension will try to pull her down. So when it pulls her down, that's where the signal to the brain saying that it's too much pain, or it cannot take the load.
So the weight matters.
Weight, yes, weight matters, because if your upper body is always bigger than
the lower,
it's going to be difficult for you to move.
Okay.
Yes.
Me pacho mini Abema Anthony FFE Dansoman. Me pacho mema wakwaba.
Good morning.
Good morning. Me pacho also waste.
Waist.
And we
Me pacho wako ayaresabe anase wako hu doctor bi amanaka se wo
can center more X-ray man. And so we X-ray man. But almost said with on your accident.
Accident, okay.
Okay. Okay. Okay. He's asking if they can come over to your center.
No problem.
Me pacho minyo Abema Anthony was say enye you can't miss so na share program no djumedi ne kwa wie ya the number ebetuja any baby or more center no wona mwakọ ho no nti messages ne de menya bebre e wo ha say nti mekan bi nso ama owura Asare nso so achem. Good morning, Nana Kwesi. What are some of the foods and vegetables that can help to cure or reduce stroke? And Abena, good morning. You look fine, please. Wish Nana Jessica happy birthday for me. A day from Debiso, me pacho Nana Jessica Atepa. Good morning, Auntie. My name is Kweku Enum from Tamale. Can too much sex cause stroke? Beautiful dress, Auntie. I want to sew some. So, someone is asking if the kind of vegetables and fruits that one can eat to reduce.
I would say mainly carrots, cabbage.
What about cucumber?
Cucumber is perfect.
Okay.
Yes. We can eat a cucumber. I would say apple, oranges, banana. Banana is the watermelon. Yes, but with the watermelon, when you take it, it's basically washing down your system, so you tend to urinate a lot.
Okay. And can too much sex cause stroke? Just like the too much exercise, can give you.
Yes, I'm just saying, please, my people, if you know you can do it 7 days, take a break.
Minia Felix, every free dodoa. Felix mpacho memo wakwaba. Hello. Hello. Yeah, Felix, mi pacho ubet mi ejina ye kakra ma me wahoma no emu ye chichi. Hello, Felix. Seminia Felix ahoma no ento mu ema ye dia said ye owura Asare kan ye no say we ye bema na efi juada ekopem kwasiada wo have sex de bia wo srew te so why enko ne bebre sa. So I mean, how many times can you?
Okay, I'm just assuming in a week. Please have an interval in between.
Interval in between.
Yes, because I mean,
so how many in a week?
3 to 4 is fine.
3 to 4. Be able money
3 to 4 is fine.
Minu Abema was so the 4 times a week. A man why was it 3 and answer 4? And yes, the beer. And as we will be so we exercise Monday to Sunday so or so. I say with me break in between. So we are not a juada or benada one yet. Benada no one yet. Queer no why ya what a sama a home emremu. Na frame free or manjo. Ya, free or manjo. Yam pacho memo wakwaba.
Yeah.
Me pacho wasembisa.
Hello.
Hi ya, me pacho meetie o. Ya me pacho. Dumu afidie na anase mute ne mame. Na ye ni nkomo anya sa ye nya feedback. Untimi nte yasam yeso ye ntimi nte wo de. Why Mr. wa wadaroma. Enti dum no na afa bisa wasem no why? Hello ya. Oh, minya ya mpacho te menka.
So, Oba, we did be 30 years. Na on should I exercise. Ni did ye so enko ye. Na pese we say, obeti we nya stroke ni biana.
Okay, me pacho tie. Obey you one why?
Pacho yo.
Okay. So, did you hear what she said?
Yes, the exercise with the stroke and
are you prone to having getting the stroke? You don't eat well, you don't exercise at all at the age of 30. Is there a possibility
you see, at the age of 30, or let me just say the milestone, 30 to 40, 50 to 60. As you're getting old, there are certain risks that can happen. At the age of 30, I would say this is the best time for you to take care of yourself. Because if you are not doing anything, how are you tending to move? Because if you plan that, at the age of 50, 60, I'm just going to be sitting doing nothing, I mean, what are you trying to gain? And now you're not exercising or not doing anything. When I say exercise, please, I don't mean go and do lifts. Or at least if you can do a light jog, you can walk. You can, do some something. Movement. Yes. If you have a lovely garden, you do your, plant your, I don't know, flowers. Yeah, you need to do some sort of daily activity, because I'm telling you, at the age of 50, like here, everybody tend to sit. They don't want to do nothing. Move. And when you come call me, I'm not Jesus.
Minyaba nana ama free labadi. Bipacho memo akwaba.
Pasho, good morning.
Good morning, dear.
Me pamocho manage media mudi pa.
Yedase.
Me so me damase pa mon koso ana monesa.
Me pacho yedase be brave.
Me pamocho na mo kan about exercise no. Na mo say ni se mo exercise 7 days ni na. If na person me who say how many days na also ye exercise. Because me exercise by me 7 days ni na. Insisti ana me who say. Okay. So ye 7 days ni na.
Okay. Me pacho koso I shall be you one why. Yo, that's pa bye.
Like I said, if you are even going to exercise day to day, you can do is you can exercise 3 days, 2 days of rest.
Okay.
And you exercise again.
You can give a break in between.
Yes, exactly. Or most of the times what you can do is you can exercise today and the following day you break. The day after you exercise again. But you see, with exercise, for example, our gyms, the gym we have here, we go to the gym and we do what we want. That's where there's no guidance. For example, if I wanted to do a push-up, if you're owning a gym, there should be a guidance.
A gym instructor.
A gym instructor, a guidance at least. Because I mean, there was a story, I think 2 years or a year ago, where somebody lifted a weight and got a heart attack. Yes.
And some people even died
exactly.
right there at the gym.
Right at the very point there. Yeah.
So I have a caller on the line. Let me talk to the person. Minya Bema Collins, free Doma. Collins, Memo Akwaba.
Yeah, I'm just
Me pacho wasembisa.
Me pacho, me nine benkum no finish sisa be si me nine nice form no me ya pama me nine no apon ayeketwa. Ni bisa say
me pacho na wako hospital ama doctor I diagnose him who say bibi wo mu ana.
Me hospital ba me da ho be 3 days class so yi me by still as an etie.
Ama wo nine yeketwa.
Na me ntimi nante so ba say me ntimi nante so ba say anka me de me nine tools no bi si wa na mapeja me mu no eno ntimi nya me ntimi ye ni fa no ba benkum ni ntimi nye.
Okay. Enti wo pese wo hu say a stroke and nasa wo pese wo hu de wonye.
Aha.
Ni mienu nyina. Okay, you mpacho so anashena obe you ano.
I think the
So
neck,
you heard him?
the neck, right?
Yeah, the leg.
Okay.
Like the foot from the waist to the
to the
foot.
leg.
She's unable to even, stand.
Okay,
and
so
move
with
on.
him having pain from the waist to the leg. Now, most males, and I'll say younger males, tend to have weak glutes, which is bad for both male
and female.
So you lie down for a second for me. So try to lift up your leg straight. No, lift it up. So you see, I asked him to lift it up. He tends to bend this way. So his glutes are weak. So relax. So when these glutes are weak, it causes sexual dysfunction. Yes. For a male aspect, for example, with the male aspect, when your glutes are weak, when you are having sex, you are using this muscle to contract and relax, contract and relax. Now, assuming that a male has weak glutes, which most of people here have seen, even the youngest I've seen, 25, his glutes are very weak, like a lady. Very, very soft, that it's very difficult for him to contract. So it's going to be difficult for him to stand long. Now, for the woman aspect, you're going to use this muscle to push out a baby. And when your glutes are weak, how are you going to push that baby? Because you will definitely have difficulty.
So what actually causes that?
Well, for example, the jobs we do, for example, the excessive sitting. Sometimes we stand for a long period. Now, with women, for example, yes, you're young, you're beautiful. When you get to a certain age, it's going to be difficult for you to get her, because this glutes or your buttocks muscle is weak.
Okay.
Yes.
Minya Kwame efrefi pobima. Kwame memo wakwaba.
Yeah, minyaba.
Me pacho wasembisa.
Mpacho masembisa ni se me nine right one edu enumere a. Asie ta hyehyeme na mpebisa se den na ekoso sana.
Okay. Me pacho mate, pacho obey you one. Unfortunately, Kwame ene ye me last caller. Yenti me mfa frɛ fo minim sɛ mo frɛ pa na nso ye brain nti yesrɛ mo. Nyame adomo adasene. Ye be bɔ modern ase yebetimi ede ye mre ni bi aka ho na course na betru ye. Enti like
yes, his leg heat sensation. Okay, with the heat sensation, another identification of lack of blood flow, that is one. Two, if there's a heat sensation, that means that there is a hip which is diagonal. So there is more excessive pressure on it. Now, when there's a pressure, it's just like a car. If your shocks are spoiled, the car will lean this way. So there's more pressure. When you press on the gas, it has to work more and more and more. Same thing with a human being. So if the hip is diagonal, there's excessive pressure to the right or the left. And when you're moving, that means that excessive heat. So lack of blood flow, and the muscle does not get enough quantity of blood to circulate.
Unfortunately, we have 3 minutes remaining, but let me go through some messages. A lady from Taifa sent a message that can too much meat cause stroke. Too much meat, and then please Edelbert from Edum Kumasi. About a week ago, I felt my left shoulder shaking continuous, and I would like to know if it's also a sign of stroke. Good morning, Abena. Please, I'm having serious pains from my shoulder to my is it clavicle?
Clavicle, yeah.
Okay. It is affecting one hand. I have done mammogram and x-ray, but they didn't see anything. So I'm afraid if it can lead to stroke.
Okay.
So the one excessive meat.
Okay, with the excessive meat, question 1, it's the type of meat we take. Okay, I'm not saying you should stop eating meat. I love meat too. So, it's the
But
meat,
too much.
but too much of it. For example, the goat meat, the fat. At least you can cut it off.
Okay.
Yes.
So even if you eat the meat, you should take out some fat.
Yeah, it's
before.
just as the fat because of the cholesterol. 'Cause
Okay.
if it's not able to, that fatty, the blood vessel will just block it, and that would cause you stroke.
Okay.
The second question was.
The second question was, shoulder, from the shoulder to the is shaking continuous.
Shaking continuously. Is it the clavicle?
Yeah, the clavicle.
Okay. Now with you doing your X-ray, most of the time you see they'll say everything is normal. If everything is normal, then you shouldn't be having pain. So with my advice, I will have to see the X-ray and see. Maybe the clavicle is applying pressure to the shoulder. It could be anything.
Okay.
It could be a swollen trapezoid or the cervical area, the muscle here. It can be anything. So
Okay,
I'll
and
have
then
to
from
see.
the shoulder to the arm is shaking continuous.
Okay. With that, if it is shaking continuously, please, I'm not diagnosing you, but I'm not diagnosing you, but it could be anything. It could be a ruptured nerve.
Okay.
It could be Parkinson's disease.
Okay.
Please don't
Get it twisted.
don't.
So the best thing is to come
I have
to
to
you.
see it for myself.
Yeah.
Okay.
So
because
your
with the hand shaking, if it's shaking or just like that uncontrollably, I have to see it for myself. It could be Parkinson's disease. It could be a muscle contraction that is applying pressure to a nerve. So it could be anything.
Okay. So your number?
My number is 020 584 1318.
Okay, so your final. Okay, you have another number.
And I've opened a page for it.
Okay.
Instagram.
What's the name?
PHY SIO underscore AND underscore CROSSFIT.
Okay.
Yes.
So your final words for our viewers.
Today is your birthday, right?
No, today is not my birthday, but one of our top management's birthday.
Okay. Well, today is my daddy's birthday, so I want to tell him, Dr. Asare, Daddy, happy birthday. Wish you all the best. May you have money, health, everything you want in this life. Amen.
Okay, so where is your location?
Well, there are 2 offices.
Okay.
One is at Dansuman.
And
one is at East Legon.
Okay.
But at East Legon, it's another clinic which is called Boakye.
Okay.
And it's a business partnership.
Okay.
Yes, so it's a physio rehabilitation.
Okay.
Yes, center, yes.
Okay.
Yes.
Enti ahwefo ahasei na ebre ebema ye kwan ama ye de ye nkomo twetwe no asi a ye fa stroke ho. Owura Elvis Asare on ye CEO of Physio and CrossFit Services. Said the okai ne number enam de 220 said the omo frɛ ya no omo pe ne number so omo pese omo kɔ honom no. The number is 020 5841 318 020 5841 318. Also, obetimi enya omo nso ewo Instagram physio_and_CrossFit. Is
Yes.
that it? Okay. And omo office no ebi wo Dansoman and ebi nso ewo East Legon. Owura Elvis Asare yeda wasi bebre say ye to yensa frɛ wo na waba ya
Before we close, on behalf of CrossFit, I want to give you this great support.
Oh,
So, thank you for having us.
Thank you so much. I really appreciate. So, on behalf of the entire crew too, I would like to say thank you so much.
Yes.
We appreciate you for your time.
Yes,
thank
thank
you
you
for coming to educate our
Yes.
viewers. Enti ashafo me gift in you. Me dana sibebre. Enti me paucha ugusoa share from morning show ewo KANTANKA television. Me did Abena chebwache. Enko baby ya ye try honam nua bema Alhaj Irobad ede yatso aso. Ye beba sisi ya.